Speech 4 stated that we must do an informative speech on a process. The process I will discuss is the embalming process. I chose the embalming process because it is unique in itself. First of all, the techniques and caution to hazardous disease and exposure places the trade embalmer in harm's way daily. For instance, there are several ways to introduce preservative liquids into human remains. One is through continuous injection and intermittent drainage. Another, and the most common, is continuous injection and drainage. Another, considered pretty aged, but used in situations where there is no electricity available, is gravitational bulb injection. Second of all, many infectious diseases place the embalmer in harm's way. Now that you have been introduced to the process that I will discuss, I will inform you of the pre, during, and post-embalming duties that explain the process of embalming. Pre-embalming involves all the tasks that occur before actual arterial injection occurs. The first task in pre-embalming is to put on your PPE, that's personal protective equipment. The embalmer must put on goggles and apron, embalming scrubs, a face mask, comfortable shoes that are heel and toe closed, shoe covers, and gloves. These items aid in decreased formaldehyde and microbial exposure. The next pre-embalming task is to clean and disinfect all surface areas of the body as well as orifices. This allows the embalmer to wash away any debris and see what things need to be done to recreate a lifelike appearance for the deceased. By checking to see what things need to be done to recreate this lifelike appearance, the final step in pre-embalming has been completed. This is known as case analysis. During embalming, tasks begin with mouth closure and implementation of eye caps. Mouth closure is crucial to giving the deceased a peaceful disposition. The embalmer may create a pleasing smile, a clean symmetrical tone, or a solemn frown. Eye caps are used to keep the eyelids in perfect abut position. Abut means that the eyelid adjoins in the lower 1/3 of the eye. The next step is selecting the right chemical for preservation. These chemicals involve phenol for disinfection, organic salts to control skin and tissue reactions to the arterial fluid, and alcohol to help the arterial solution penetrate the tissues, neutralize bacteria, and stabilize formaldehyde. Dyes are also sometimes used for the embalmer to keep track of fluid distribution and detect where coagulation may be present. Coagulation is defined as clotting. In embalming, coagulation can cause stenosis, which narrows the passageways in the arteries, which makes fluid back up in some spots, which hinders distribution to all parts of the body. The embalmer can use something called anticoagulant, which disrupts this clotting. Once the correct arterial fluid is chosen, they must be placed into the embalming machine for mixing. The next step is vessel selection. Here, the embalmer decides which site to raise the vessels for injection and drainage. The most common sites are the right and the left collarbone. This is where the left and the right common carotid arteries are located. A lateral incision must be made over the right collarbone with a scalpel. An instrument is used to raise the artery and the vein. A cannula, which is a small metal tube that is inserted in an incision made in the artery. The cannula is connected to a hose that is connected to the embalming machine. This is how the fluid is introduced into the body. An incision is placed into the vein to allow for the drainage of the deceased's blood. So in essence, arterial solution replaces blood. Once drainage is complete, both vessels are tied off with a ligature, and that is pretty much a very strong piece of thread. The embalmer must then do something called aspiration. This is when a long metal suction tool is inserted into the left umbilical region of the deceased. The body's bile, uric acid, and abdominal fluids are extracted and replaced with preservative deodorizing cavity fluid. This is the final during embalming step. The first post-embalming step is to suture all incisions and pack orifices with absorbing cotton. The body should go through what is called terminal disinfection, simply meaning to wash the deceased and check for any discolorations or breaks in the skin. Once the body is inspected, they are ready for dressing and for casting. As you can see, the embalming process is very involved, requires technique, caution, and multifaceted. Each subcategory, pre, during, and post, relies heavily on the tasks of the form. Now that I have introduced you to the process of embalming, I hope that you have gained a better understanding of the profession and what it takes to succeed in it. Thank you.
Wonderful,
Thank
wonderful,
y'all. I
beautifully.
appreciate it.
Beautiful, beautiful, beautiful. I want to do it. Hi, class.